mental health services in Denver is incredibly difficult these days. There are people being turned away, a lot of them. Our Kelly Rinke looks at what's being done about that.
Sometimes when we're providing mental health care, it's like a little bit like drinking from a fire hose.
The demand for help is too much to keep up.
Typically, we turn away as many patients as we can actually see.
Dr. Christian Thurston sees this challenge firsthand as the director of behavioral health services at Denver Health.
The main finding is that people have difficulty accessing behavioral health care. They wait on average 27 days to get treatment.
This finding wasn't a surprise in a report from Denver's health department. The agency learned the high demand for services is something providers can't meet.
So on the provider side, the assessment indicated many needs. The primary needs related to recruiting, burnout, and retention concerns.
DDPHE went over the report with city council members on Wednesday and discussed plans to hopefully fix the problem.
So we have 20 contracts that will be addressing behavioral health specifically.
The contracts will add up to more than $10 million in federal funding. Denver Health says it plans to use that money for a detox program to help young people who overdose on fentanyl.
We used to just discharge them with some outpatient referrals. Now we can admit them for a few days, stabilize them.
Getting people the help they need requires funding and staff.
Staffing is a big part of it. I think funding to sort of help stay competitive in the job market is adjacent to that.
Wellpower, like other providers, saw employees leave during COVID.
Yes, and unfortunately, they haven't been coming back.
Insufficient staff was the top problem impacting services for nearly half of the providers surveyed in DDPHE's report. Helping people is getting harder to do.
The need is enormous. I think it's always been enormous, but we're just kind of now recognizing it more and more.
Denver Health this month said the cost for uncompensated care continues to go up, and it's forcing them to close at least 15 beds for substance abuse treatment and mental health care.
So I imagine they're looking for all kinds of alternative ways to see people in crisis ASAP.
Yeah, so like Wellpower, for example, they're looking at essentially a virtual urgent care. People can sign up and immediately see a therapist while they wait for additional services.
All right, Kelly Rinke.